So Robin, thank you so much for doing this Q&A with us. Robin McNelis is a cardiorespiratory physio.
I know that there's a lot of people who think there's nothing being done about long COVID. There is actually lots of research going on.
He has a special interest in long COVID after a COVID infection in March 2020 left him with the condition.
I had a blood clot in my lung, I had pericarditis. I knew that things weren't right.
Today, he's answering all the questions that you had about long COVID.
Talking about long COVID being like a sinking ship.
Why aren't I any better after 4 years other people are recovering?
We know that there's lots of different mechanisms that go wrong, and we know that not all long COVID is the same.
How to not gain weight and or lose weight during long COVID, it's impossible.
Single mothers of 3 children that are working 2 jobs, and I feel heartbroken for them that they're caught in a situation that no matter what I try to tell them, it's just not going to be curative. There was one piece of research from UCLH that estimated about...
Hi, I'm Bella, and in May I started the 65-65 challenge. If you have been following along with 65-65 the last few weeks, you will hopefully know full well who Robin is, and hopefully very excited about what we're going to do today. But if you are new, then just a little quick intro. So the 65-65 challenge is what I set up in May, and it basically asks you to do something 65 times for the 65 million people living with long COVID. We had an absolutely amazing response with people all around the world taking part, including Robin. So a little bit about Robin. He is a clinical specialist physiotherapist and he's got lived experience of long COVID. He got it in March 2020, and he decided that for his 65-65 challenge he wanted to share 65 pieces of information that are important in managing long COVID and looking towards the recovery from it too. So we've been sharing these for the last few weeks. Hopefully you've been seeing them. If not, go onto our Instagram, go onto our other social media and find it. But it had such an amazing response, and so we thought that we'd do a Q&A. So that's what we're doing today. And I'm so excited to be sharing that with you. The questions are all from what's been asked on our social media. So I have been putting kind of things out trying to get questions. We have had an amazing response to that. So thank you if you're one of the people that asked us a question. And obviously Robin, as the expert, is going to be answering them, but I hope too that I can add my own experience, because I do feel like it's important with long COVID to be sharing as many different stories as possible, because obviously everybody has such different experience. So Robin, as I said, he's a physio, but he's a cardiorespiratory physio. So he has a special interest in breathing pattern disorders and obviously long COVID recovery. He offers services such as long COVID assessment, breathing pattern retraining and cardiac rehab. So if you're interested in any of them, go onto his page and you can find out more there. And then for me, I had long COVID from November 2021 and I'm now pretty much recovered, and I'm sharing all about that recovery on an Instagram page called the 65 Club, and then I'm also continuing to run 65-65 challenge. Hopefully this is going to be really helpful and informative and you'll get a lot from it. So on to the questions. So Robin, thank you so much for doing this Q&A with us.
Thanks for having Bella, and thanks for all the hard work you've done to put together all the resources that I pulled together for the 65 for 65 project. It was a lot better than I could have done.
Thank you. I know, well, hopefully the ebook will be ready soon and people will be able to download that. But yeah, no, thank you for doing this. Hopefully people are going to find it really, really helpful. We had so many questions, but we won't be able to answer all of them because we had so many. And obviously some of them were quite specific about people, so we wanted it to be slightly more general so that it can kind of be an overarching advice for everyone.
There was some of the questions that came in that were maybe very valid, but they're very specific, or that they're maybe quite medically based and really weren't within my remit to be answering. So we've read those questions. Sorry that we can't give you those answers just now, but it's just maybe not the most appropriate forum for them.
Yeah. So we'll start with the questions that were kind of more specific about long COVID, the kind of general, where it comes from, and all that. So someone asked, how and why does it happen? Now, obviously, you're a physio, so we don't want to go too kind of medical, but just in general terms, can you kind of give us a little bit of information just about long COVID in general?
Yeah, so long COVID, as we know, is after a positive or suspected COVID infection when things haven't recovered normally. And for all that there have been lots of people impacted with long COVID, there's been lots of other conditions over the years where the body has just reacted against itself. And whether it's an infection that somebody gets and then they end up getting ME, chronic fatigue syndrome, or various different other conditions. So it's not unique to long COVID, it's just that it was a worldwide pandemic. It has been a massive event in our lifetime. And we know that there's lots of different mechanisms that go wrong. And we know that not all long COVID is the same. And there's lots of research being done into what is going wrong with different people. And they're trying to divide people up into different groups, different presentations. So two of the most common ones that we've been seeing are people with almost like a chronic fatigue type picture. And there's lots of research going on to the mechanisms for that. There's also lots of people that are getting a very POTS type picture, so people with heart rate and blood pressure abnormalities. And we know that severe infections can sometimes really disrupt the various different systems, whether it's the autoimmune system, whether it's the things at cell level, whether it's the vagus nerve, lots of different things. And I remember at one point hearing a presentation about a doctor who had identified over 200 different faulty mechanisms.
Wow.
And his theory at that point was that most people will have a cluster of those. And a lot of them may be connected, may not be connected. And that's what makes it so difficult to treat, particularly since most of the testing that is done comes back normal. People are short of breath, but their lungs and their heart are fine, their bloods are fine. So it makes it really, really challenging. And quite often it is a diagnosis of exclusion. We exclude all the nasty things like cancer, heart disease, lung problems, etc. And if there's no other explanation, then you're doing a bit of detective work, and quite often it will lead to a diagnosis of long COVID.
And is that why then, because we had another question about why so many people with long COVID are getting other disorders, and I guess that must be related in terms of kind of if there's different mechanisms that are going wrong, that'll all relate to the different disorders right now.
Yes, and we know that if people maybe have got a lot of fatigue, but they've also got POTS, then they will play off against each other. And we know that one faulty mechanism will play off against another faulty mechanism. So if you've got a problem that is causing excessive fatigue and you've got maybe some viral persistence or problems with your immune system, then they'll play off against each other and it'll be a downward spiral. And then if you can boost one of those areas, it can quite often lead to improvement in other areas, but is so frustrating for patients, also for clinicians, because I've got a foot in both camp, having long COVID and also treating people with long COVID. So it's a lot of detective work that we've got to do at times. But yeah, it's so much is interrelated and so much plays off against each other.
And then go back to kind of the different camps that you were talking about, the CFS and the kind of POTS type. Does that then go into why the symptoms vary so much? Because I know both my mum and I had long COVID, and I mean, we were kind of similar in some areas, but also poles apart in other, and kind of very different stories, really.
Yeah, and I think that what hasn't been established yet is all the mechanisms of what's going wrong. And I know a lot of people are frustrated that we can't just come up with a drug or a treatment that will help, but there is research going on. But in the early stages, we were trying to stop people dying from COVID, let's face it. We're then trying some repurposed drugs to essentially deal with the symptoms without really understanding what symptom problems were going on. system problems were going on, and they're now trying to look at what exactly are the different mechanisms that are at play with different people. Because if we can understand the mechanisms better, then we can devise treatments better. But that takes a long, long time. So I know that there's a lot of people who think there's nothing being done about long COVID. There is actually lots of research going on. But I think that if anybody who's listened to David Petrino talk, one of his frustrations was that from a bit of research being completed to it being commonplace, on average takes 17 years. So there's a big movement to try to speed that up, and that's one of the things that COVID has really tried to push forward, is to get things research done quicker, even though it seems like a snail's pace, and to get it out so that it's normal in primary physician GP practices quicker.
So we then had another question about why aren't I any better after 4 years other people are recovering, and I guess that plays into the different mechanisms, but also people's lifestyle factors as well.
Yeah, indeed. I think there's lots of different things going on, and lots of people were severely impacted by the acute COVID infection, and that plays a part, and also how they have been treated or how they have progressed since then. And at UCLH, they had one group of people that roughly a third who were getting better. One group that were making an overall upward trajectory, but with some ups and downs. It was taking a long time. And then there was one group indeed at the bottom who really weren't getting better. So they're really looking at those people that were most impacted as to why were they not getting better. So there's one group that they had maybe been in intensive care and had really severe COVID. They were left with organ damage and they're struggling to progress, which is quite understandable. There were other people that for one reason or another, they were unable to or unwilling to engage in a lot of the lifestyle factors. And we know from, I think it was University of Leeds did a study that showed how frequently people engaged with one of the apps that they were using, and then they correlated it with the improvement people were showing. And the people who were more engaged with it were getting better and getting better quicker. But there's lots of reasons for that. Sometimes people, their cognitive fatigue was so bad they couldn't really engage with it, and that's understandable. There's other people that are just trapped in rotten situations. I've had single mothers of 3 children that are working 2 jobs, and I feel heartbroken for them that they're caught in a situation that no matter what I try to tell them, it's just not going to be curative. It's not going to get them back to where they were before because of the pressures upon them. We often talk about trying to hit that sweet spot that people should be exerting themselves to a degree rather than sitting and doing nothing or lying and doing nothing, if that's at all possible. But they shouldn't be doing so much that they're going to trigger symptoms. And it's so difficult for some people to actually achieve that sweet spot, and that is no fault of their own. So it's a real complex one, and without knowing the individual case, it's difficult to say for them as an individual, but I really feel for a lot of these people who are trying their best and they're just not progressing. And it doesn't mean that they can't try. One of the things that I have seen is that there's some people that will say, well, that doesn't work, so I'm not going to do it. But then it might lessen their symptom burden if they do try it, even though it's not going to take away all the problems. It might lessen how badly they feel. It might help them to get to a period of stability from which they can slowly progress.
Yeah, I mean, I always say for things like meditating and all the kind of resetting stuff, it's not going to do you any harm.
Yeah.
Like, even if it doesn't help you so much, you might as well. It's the same things like the sleep hygiene. If people are kind of really severe fatigue, yeah, that might not necessarily, the kind of sleep stuff might not be the best for them, but even just giving it a go, it's not going to do anything negative, is it? So,
Indeed,
I don't
indeed.
know.
I think that it's about trying all these different things. And in one presentation I heard, they were talking about long COVID being like a sinking ship that was being pulled down by a dozen anchors. So you may do one thing like sleep hygiene, and pull up that anchor, and that doesn't help you. But you've got to keep that anchor up, because then if you just chuck that back in and then pull up another anchor, like, for instance, refreshing your diet, or increasing your fluid intake, or working on your pacing, it's about pulling up all of those anchors and keeping them up and really building on it. But it is really challenging. And there are some drug treatments that are slowly emerging, quite often repurposed drugs. But what we do know is if you have the repurposed drugs or whichever medications or treatments you can get, they work best when you're doing a lot of the lifestyle factors as well. In the same way with cardiac rehab, if you're on statins, beta blockers, etc., and you do the principles of cardiac rehab, your cardiac risk factors fall and you're less likely to have another heart attack. So it's about doing everything together.
That's such an amazing analogy. I really like that, because I do think it is all kind of doing everything at the same time. And going back to the kind of why people recovering and I'm not, I always say I was so lucky at the time that I got it, because I was out of the school system. So I didn't have anybody kind of bugging me about attendance, about anything like that. College are amazing. You kind of just being like, come in when you want. And I was still at home, no responsibilities. I had basically 6 months off, and it was incredible because I could literally just spend all my time recovering. But I was so lucky and so privileged to kind of have that. But for people that don't have opportunity, even my mum, like looking after my nana, that's a kind of like a not a burden, but in terms of the fatigue, in terms of the recovery, it doesn't allow the same as other people. And so definitely it's all about the factors and the
Yeah,
place that you are in life as well, isn't it?
indeed. And I think you touched on school there, and I'm actually now dealing with a few parents who are helping to guide their children. And there's a bit of a misunderstanding with some of the schools. So some of the schools are saying we'll do whatever we can, but then some of what they can is give the child one-to-one PE to build up their stamina. Well, that's not a clear understanding of somebody whose fatigue is really, really out of control. And it's also the things around going into school for an hour. Well, that's not just going into school for the hour, for all the physical, cognitive, social, emotional, sensory exertions that is going to happen in that hour. It's about somebody getting out of bed, getting hydrated, nourished, washed, dressed, and then commuting to the school and then back again. So it's not sometimes the hour that's in. And don't get me wrong, I'm not saying that children shouldn't go to school if they've got long COVID. I think that it's really important because of their stages of development and all their neuro shaping, etc. So they need exposure in all those different areas, but it's how can we do it in a way that we can keep children in school. And sometimes that means about stepping back a little bit. And we've got the school holidays coming up. Although the Scottish schools are already on holiday, so some of the children and some of the teachers that I'm working with, it is very much about using that long break off to not do nothing, but to try to reset a lot of the foundations and then do a little bit of work or school practice, so that you've got more resilience to cope with that when you get back in August or September.
Yeah, and that's exactly what I kind of had to do. My OT was very much like, because college offered me to go in for like just an hour, and she was like, no, you can't do it. You need to go in for like a morning, because it is everything else that comes along with it. And I think it is. I mean, it speaks to kind of a greater understanding of long COVID and other chronic illnesses. People knowing that it's not just the learning, or it's not just being in the kind of social environment. It's every single thing, and then that kind of building it up. And I remember kind of doing like a mind map for the first time when I had all that break off, and oh my god, it took so much out of me. But I'm so glad that I kind of very slowly built up, because
Yeah.
otherwise I just would not have been able to go back to September the way that I did.
Yeah, so I think it is about getting that balance, and it's really, really difficult. Lots of people have said to me, and I've experienced it, pacing as strictly as you need to is really challenging, really, really challenging. So this isn't easy. This isn't about, just take it easy. It should be about self-sacrifice. It should be about easing back so you can get that stability, so that children that are struggling just now, in a year's time, will be sitting exams and doing well. It's not about getting them better for next week or even next month. It's looking at next year, looking at their university, if that's the way they want to go, so that they can do things really well. Because we've had so many people that have either had failed return to work or failed return to school or university, etc. And it's sometimes taking the long game rather than the short game.
Definitely. And I always say I'm so glad that I took that time off and that I did have a kind of a very, I mean, it was, like I said, kind of 6 to 9 months off, but I would not have been able, I mean, I couldn't. When I initially went back to college, I couldn't. And so the thought of not having that time, but again, that speaks to kind of, the different factors being allowed to have that time and all that.
And I think as you touched on, that's a very privileged position that you were in, and a lot of people don't have that. And I think what we're trying to do with a lot of this advice is to give people tools to work with the best that they can for their individual situation. And we know that people have maybe got other ongoing health issues, and yes, doing some meditation isn't going to help your lung condition or your heart condition, but it could help it along the way. It could get you on the right path, and it's just one of the tools that you can work with. And the more tools you've got, you find that some work for you, some don't work for you, and some work for you at some stages of your recovery and not at others.
Yeah, that's so true as well, definitely. And I think about being like open to it as well, because I do feel people sometimes are quite closed off to it. But actually, like I said before, and like you said, you don't know what's going to help. So, and going back to that anchor metaphor, amazing. So we had quite a few questions about kind of diet and weight. So one was how to not gain weight and or lose weight during long COVID. It's impossible.
So yeah, it's obviously I'm not a dietitian or a nutritionist. I can speak a bit about my professional and personal experience. I put on 15 kilos, which is 2.5 stone, in the first year that I had COVID and then long COVID, and then did a diet analysis. And I think that's the first place to start, is just taking a note of everything that passes your lips, whether it's the water that you've just taken a drink of, to give a judge of how well hydrated you are, whether it is the little treats that you've had, just having a look to see. And one of the things that it showed up for me was that I was a runner. I was used to having a high carbohydrate diet, but I was also mindful about protein with every meal. When I did a snapshot, it showed that I was having way too much carbohydrate when you consider that my fatigue meant that I was not burning off lots of carbs because I wasn't doing higher level exercise for prolonged periods of time. So that fat, those carbs were getting changed to fat, and my visceral fat around my abdomen went up massively. And that had lots of different knock-on problems. Also, although I was conscious about having enough protein going into my diet, when I looked at what I was actually taking in, I was taking in about a third of what I should have been. And I thought I was doing fine on that. So getting about 1 gram to 1.5 grams of protein per kilogram of body weight, which is a lot of protein. And that's the British Dietetic Association's guidelines. That's not me saying it, and it's not any bodybuilding thing or anything like that. It's about getting those nutrients in. And so I think that what worked for me is reducing my carbohydrates, taking my focus onto protein and vegetables. So if I was having a meal, I'd have lots of protein, lots of vegetables, and then a bit of carbs, and then only eat the carbs if I felt that I needed to. The other thing that I had done, and lots of other people have done, is we've got lack of energy. So we're trying to put energy in to try to give us a bit of a boost. But we've got to remember the mechanisms. It's not lack of energy in that's the problem. It's the way that our bodies are using that energy is in some way broken or inefficient. I think that a lot of dietary things are very individual. There's a lot of things that isn't evidence-based out there. Does it mean that it's wrong? just means there's no good evidence for it. And as healthcare professionals, we're limited as to what we can actually be recommending. But one of the things that the dietitians have often told me is that really the best thing is an individualized approach for you as an individual. So there's no point in somebody taking lots of really high nutrient dense foods in one particular nutrient if they're not deficient in that. One of the things being vitamin B12, that if you're not deficient in vitamin B12 or you're not deficient in vitamin C, then there's a lot of that just goes out through the urine. So you're just flushing out your system and could theoretically put your kidneys under a bit of strain. So I think
I got told off for taking too much B12.
yeah, there's people that have actually been pitching up in A&E because they've been over supplementing, so that's something we've just got to be really cautious about. And I think that there is some research, and David Petrino talked about it from New York, about a lot of research about trying to get the right supplement package for the right presentation, but they always do it with medical supervision and regular blood tests to make sure every 6 months or so that somebody's liver, kidney function, etc. is going well. So I think that if in doubt, get a good dietitian to have a look at you. But the first place I would always say to start with people, take a food diary, because that's what any good nutritionist or dietitian should be asking you to do as the first step. If you've already done it, sometimes you'll come up with the answers for yourself. And I think just being careful with things that give you a bit of an instant boost, because they usually cause a bit of a crash. So didn't directly answer that, but hopefully giving people a little bit of an idea that there's not one diet that fixes all. It's about looking at getting all the right things in. One thing I will say is that I've had a lot of people that have switched to being vegans, and so they'll get lots of their plant-based foods in by definition, but quite often they are lacking in a lot of the nutrients that go along with protein. So it's not just about the protein, it's about the calcium, the magnesium, etc. So I'm not saying to people, don't go plant-based, don't go vegan. What I'm saying is you need to be getting in a certain amount of the correct nutrients. It's more challenging if you're doing that from a vegan diet. So how are you going to meet those nutritional requirements? And I don't tell them what to do. I ask them the question.
Yeah, and I think as well, like it kind of goes back to the balance and everything. I know personally, I actually lost weight initially because I really struggled with like gastro issues and nausea and stuff, and so for me it was just kind of like whenever I fancied it, just eating what I could, but balancing all the different things, because initially I tried to go the antihistamine diet, and then I realised that kind of the vegetables I really struggled digesting all of that with my gastro stuff. So then I kind of swapped again, and I think it's just about managing it all. But also, if you're really fatigued, it's so hard to make yourself a good meal. We lived off chocolate potatoes for a long time, and I think that's kind of another thing to say. Like, obviously, it's, you know, we all want to have the best diet possible, but at the end of the day, I kind of think if you're getting the food in, that's kind of the most important thing. You're trying to get it as nutritious as you can, but also, you know, it's kind of managing it, isn't it, alongside the fatigue.
Indeed, and I had a young lady that was basically taking a packet of maybe flavoured rice out of the cupboard, sticking it in the microwave for a couple of minutes, and that was her main nutrition for the day. So for one, not enough calories, and not exactly packed with nutrients. And we're talking about getting protein sources in, but that's when the cost of living crisis would really start to bite. And it's one of my trackers, because at that time you could get a tin of sardines from Tesco for about 40 pence, and it was 20 grams of protein in it. And she really liked fish. So I was saying, look, open a tin of sardines, stick them on a couple of rye vita, and then you've got your omega-3s, you've got your protein, you've got some calcium. If you're having it on rye vita or something, then you've got some fibre going in as well, and more complex carbs. So it's about thinking, how can you do the nutritious things easier?
Yeah.
Because it's really challenging when money and energy are scarce.
Yeah, 100%.
But yeah, as I say, I'm not a dietitian, I'm not a
No,
nutritionist,
yeah.
just talking through some of my personal and professional experiences.
Yeah. Well, going on to what your kind of specialist subject is, the cardiorespiratory side of things, we had a lot of questions about breathing. I myself struggled with my breathing for a very long period of time. And yeah, so we had a lot of different questions. One was about breath holding. Caroline says, is it a good idea to practice breath holding? She says she's read mixed opinions about it.
So I think with a lot of different breathing techniques, it's not that you just breathe in one way. There's different breathing techniques that can either be used as a form of assessment or a form of treatment. And I think that that's where you really need somebody who's specialised to have a really close look at you if you have got a breathing pattern disorder or have got some unexplained breathlessness. So when you're doing breath hold techniques and the various versions of that that can take part of the assessment treatment, where you will be breathing in, breathing out, hold your breath, or breathing in, hold your breath, and how far do you take it? Is it to the first sensation of needing to breathe or pushing it to the absolute limits? And a lot of that is a reflection on your carbon dioxide levels, and it can be an indication if you are hyperventilating or breathing inefficiently. And remembering that hyperventilation does not need to be your Hollywood type panic attack. It can be quite subtly over breathing. So it might be that you're just taking 16 to 20 breaths per minute, whereas physiologically you're only needing 8 to 12 breaths per minute. But it also wraps in about the depth of breath, so not just the rate of breathing. And then you're looking at the mechanics of breathing as to are you nose breathing or are you mouth breathing? Are you using your diaphragm and your lower intercostal muscles between your ribs? Or is your prime muscles of breathing your upper chest breathing? So it can get quite complex. And you can have either a biomechanical issue that you're using the wrong muscles, or you can have a biochemical issue that you've got into a chronic over-breathing pattern, which can be quite subtle.
Geeta says she hyperventilates when she sleeps. Do you have any tips for that?
Yeah, so a lot of that is because you've got conscious or semi-conscious control or awareness of it during the day, and you don't have that overnight. So it shows that the biochemistry is a little bit knocked off. So it's about really working with the breathing pattern retraining. And there's lots of different breathing exercises out there that can help you in lots of different ways. But they're quite dynamic breathing techniques. So it's really about resetting the lax breathing at rest. So there's a group called Physios for Breathing Pattern Disorders that I'm a member of, and one of my colleagues has put together a package of videos and resources on the website that people can go on that, reset the foundation breathing. There's also a breathing test package on that as well. So we can maybe pop a link to that in this post so that people can go and have a look at that for themselves.
And I think if it's not already, then I will put it in, but it'll be in the ebook links as well.
Excellent.
So
Yeah, I think it's one of the useful guides at the end, if my memory is certainly correct. So yeah, I think for Geeta then, it's really about trying to reset the breathing and re-educate the biochemistry during the day. And I think you've got another question about air hunger. That's one of the things I was about to say with Geeta. She may experience a little bit of air hunger. Now, what is air hunger? I'm often asked. It's that sensation you get when you feel you need to take another breath or take a big gasp. It's the weird sensation you'll get when you were a kid, if you're seeing how long you could hold your breath for underwater. And that you get that big urge to breathe. Now, that is actually your carbon dioxide levels increasing rather than your oxygen levels dropping. So that air hunger is that desire to take that deep breath. So one of the ways that the breath holding can be used in the correct patient is to be exposing them to a little bit of air hunger to help to reset their carbon dioxide levels that the body's accepting, because that's sometimes become a little bit disordered. But the reason that I urge caution with a lot of the breath holding techniques is in some patients it works really, really well. In other ones, it can become a real strong trigger and it can give an anxiety response and knock them off. So it's about knowing your patients really well, having an individualized approach, and getting what's right for their right patient.
Mm-hmm. Gabriella wants to know if you can still have a breathing disorder even though you nasal breathe.
Yes, you can. Long short of it. So nasal breathing is certainly better at rest and lower level activities than mouth breathing. However, it's just one section of it. So when we talk about nasal breathing, when you breathe through your nose, then you get the mucous membranes, the hairs, etc., filtering, heating, humidifying the air that's coming in, which means that it's better air that gets down into your lungs, it's warmer, it's more moist, so it can be absorbed more easily. So she's completely correct. Nasal breathing is better. Also, when you breathe out through your nose, a lot of the chemicals that are being produced beneficially in that nose breathing cycle are deposited in your nose, as is moisture. Whereas when you're breathing out through your mouth, as you do in some relaxation techniques, and that's fine for that moment, but if you're normally breathing out through your mouth, 75% of the moisture and the nitric oxide is lost. Whereas 75% is retained when you're nose breathing in and out. So if I'm looking at you just now, you've got your mouth closed, you don't have gills, which means that
Really
you're going to be
conscious.
breathing in and out through your nose, apart from when we're talking. So yeah, nose breathing is one part of it. And when you're nose breathing, you're more likely to use your diaphragm better, but not necessarily. So you can get people who have got quite ingrained patterns that they may be nose breathing, but they may be nose breathing and using their upper chest to breathe rather than the diaphragm, and there can be lots of reasons for that. Equally, their rate or their depth of breathing can be wrong. So if I do a period of nose breathing, so that's nose breathing, and that's maybe an exaggeration, but I was breathing too quickly and too deeply, and now I'm getting a little bit dizzy because it's a form of hyperventilation. So yes, nose breathing is one part of it, but it's not the be-all and end-all. It is about nose breathing rather than mouth breathing. It's about using your diaphragm and lower intercostal muscles to get what we call circumferential breathing. So it's everything moving out, not just your belly coming out. It is about your rate, rhythm, and depth of breathing and putting everything together. And those videos on the link that I talked about, there's videos of what is normal breathing in lying and sitting and standing, because it changes, because your muscles change how much they're working, particularly these muscles here, when you're sitting or particularly standing.
I'm really consciously breathing now.
Yeah, keep breathing, please.
But I really struggled for a long time, and I ended up going to a respiratory physio, and she said I was like really at the top of my chest, but also I would breathe more out of, I think it was the left side, so I wasn't expanding on the right side as much.
Yeah.
And she gave me a lot of tips, and they really helped me, and they really helped with all that. So yeah, I hope everyone finds that useful and can get some benefits from that, because I found that it was one of the key things for me.
And we talk about breathing retraining, etc., and doing breath work, but we know from studies in elite sporting performance that just doing your breathing at rest can get a 1 to 4% performance improvement at top level sport. So when you're looking at marginal gains, that's quite massive. And I was speaking to somebody who's quite sporty, so I was trying to get into their mindset, that because they didn't want to be in a patient mindset, they wanted to be in thinking about things in a sporting way. And when I was talking about, well, it comes under marginal gains, they said, well, if you put 10 marginal gains together, you could get a 10 to 20% improvement, which I'm sure most of us would be really happy with at any given stage. But it takes a lot of effort, and you've got to work on it, and it doesn't change overnight. You've got to keep working at it.
Yeah, I think it probably took me a good few weeks at least just to get to the point where I was kind of doing it just regularly, and to the point where I wasn't kind of being, I had to set loads of alarms on my phone and stuff to kind of keep doing it, but as soon as I started doing it regularly, then it did really, really help.
And it really helps to re-educate it, and you just got to keep with that consistency to retrain it. So, because you're using your conscious brain to retrain all these subconscious activities that happen in your body. I always say it's a bit like somebody who's had a mild stroke, they're trying to pick up a cup. They've got to do hundreds of repetitions of the correct movements per day, and then it'll become automatic again. A little bit the same with breathing. But if you've got really strong triggers, you can do all the breathing exercises you want. You're less likely to get better. And you've got to look at what is triggering your bad breathing as well.
Yeah, definitely. So moving on to the kind of living with long COVID side of things, we had quite a few about getting used to it. So one person says, how do I get used to a situation that leaves me unable to be independent? And another said, I get so tired and breathless, I've had to give up work, which I love, struggle to shower and look after myself. My doctor says I've got to get used to my new situation and work to acceptance. What can I do to improve things?
Yeah, it's
Resonate with that.
really challenging, and I think that particularly with a lot of this stuff around the previous guidelines for MECFS, saying that basically you needed to have a bit of therapy, you needed to get on with it, doing graded exercise, which we know is not the case. It means that is a really controversial issue around having counselling, because it's not just in people's heads. This is a real problem. However, because it's a real problem, it does have an impact on you from an anxiety point of view, from a mood point of view, from a behavioural change point of view, about you're having to get to a point of thinking, well, it is what it is. I am where I am now. And how do I move forward with that? And that's really challenging. And lots of people have had to give up work. They've not been treated particularly well. I got really frustrated when I was working in the NHS about a lot of the patients that were losing their jobs. And I knew that if they'd been treated differently, it didn't need to get to that level. So my heart really goes out to a lot of these people. I think that speaking personally, I almost got pushed towards having counselling from our occupational health department. I think they thought because of what I'd been through, I must have been really traumatised. I wasn't. I had a blood clot in my lung. I had pericarditis. I knew that things weren't right, and being told I had those was actually validation for me. Equally, when I got told that all my subsequent tests were clear and I had the chronic fatigue picture of long COVID, again, it was like, right, okay, what can I do? It is what it is. How do I move forward? There's no medical cures for it. And that was it just overlapped with my periods of psychology input. And what it really helped me with was accepting where I was at that point. It didn't take away my blood clot, didn't take away the pericarditis. Fortunately, drugs helped with that. It certainly didn't take away a lot of the fatigue. But what I was looking at was the emotional triggers that were draining me. And how could I work with those better? And how could I be helped to come to terms of, I am where I am just now, but I didn't just want to stabilise at that level and live my life like that for the rest of my days, but I had to accept where I was at that point so that I could stabilise and then move forward. And I changed jobs several times and then eventually went independently because then I had control of how I could work. So I've been through a lot of things. It's been quite challenging times, and it is difficult to come to terms with it and to move forward. But there's lots of people that will say to me, "But this is what I've always done." And there's lots of people that have been really driven individuals, and that has got them to where they've got to in life, and quite often been great successes. But then that doesn't work for them anymore at the moment. And it's about working optimally. And whereas they used to work optimally by working maximally, now working maximally sends them backwards. It's about moving it to the left, finding out the right level for them, and then they can start to move forward.
Yeah, definitely. Moving on to kind of the pacing side of things, Helen asks, do you have any tips for micro pacing, particularly in the shower? She says that she already uses a shower stool.
Yeah. So interestingly, I got asked this question just a couple of weeks ago by one of the patients that I've been seeing, and she'd been really struggling for 4 years, and she had said, "Well, I'm already sitting down in the shower, so there's nothing else I can do about that because that's as paced as you can get it." And then we talked through a few of the different things, and I talked about the step count that people get when they're showering. It's not a truly step count, it's about how many times you've moved your arms. So I've set, particularly some of the younger people I'm dealing with, a challenge of how do you get showered using less steps, as it were. And that's one of the things that I did and got lots of other patients to do. So, for instance, for me, it would be more difficult for you because you've got nice long hair. Shampooing hair, particularly if you've got a breathing pattern disorder, is exhausting. The more that you're using your hands either above mid-chest level or extended to any degree wipes you out. The more you use your hands generally when you're in the shower will wipe you out. And if it's a warmer shower, then you might not realise it. Because it dulls down your perception of how hard you're working. Plus, blood will be getting pulled not only to your vital organs and your working muscles, but also to your skin if it's warmer. So one of the things, having a cooler shower. So I'm not saying having an icy cold shower, because some people that really triggers them, but having a cooler shower, as cool as you can tolerate, without getting the shakes and shivering. That's one thing. Obviously, sitting down, that can help as well. Letting the water do more of the work. So if you've got your head wet, rather than having head wet and rustling up your hair, then putting your head under the water, resting. Put some shampoo on, rest your arms, put the head under the water again. Just a hand for the last little bit. Literally taking breaks, and then when you come out the shower, wrap yourself in towels and just sit. Sit in a chair, put this toilet seat down and sit on there, and don't try to dry yourself off. And then when you are coming to drying yourself off, do one limb at a time. When you go to get dressed afterwards, make sure that you are properly dry, and do the things that are toughest first. So what lots of people will think, oh, I'll do my top half, that's a bit easier for some people. Then I'll put my underwear on, and then I'll put my trousers on, and then I'll do my socks because that's going to knock me backwards. But then sometimes doing the harder things first when you've got a bit more energy, and literally do one sock, take a break, another sock, take a break, and working it that way, and working out what works for you, and playing a game of how can I break this down to try to keep as much energy in the tank as possible. And lots of people will probably be thinking, but that's going to take forever. Yes, it does. It takes a lot longer. What I try to say to people is reframe it. Whether it's not about how long is it from the start to the finish of the task, like from having a shower to getting fully dressed. It's how long does it take from you starting that task to be fully recovered to go again? And that's the same for a lot of principles. And I think we're going to come on to stair climbing, so it's again to do with that. It's about keeping that energy in the tank so that you can function better, so that you're actually doing the tasks, but you are doing them in a slightly different way. And I've also had people that we've just had to, I've got a husband who's not impressed with me because I've not only got him washing his wife's hair now because she's got nice long thick hair, but he's also drying it now as well, and he's a very devoted husband, all credit to him, but I think he must think of me of what else are you going to get me to do. But that has really helped her heart rate variability stabilise, and I've used that example with lots of other patients, so I've got loads of people that are doing that, and it's breaking it down, and it's really, really tough.
Yeah, and I think as well, it's like, even if it takes so long, how long is it going to take you to recover from like the crash or
Yeah,
whatever it is that comes from that? My physio said to me, like, even if it takes you 2 hours to walk up the stairs, make sure you do it so that every stair you go up, you come back down again. And it's the same things, like, if you have that luxury of time where you're not pressed to, shower in half an hour, why not take as long as you can and make sure that you are safe all the long time? Because no one's watching. Like,
yeah,
no one's actually gonna know. It's the kind of like the societal expectation that you shower in that in a specific order and it takes this long, but actually no one is gonna know. No one's watching.
yeah.
So do it however you want. I never dried my hair. I would. I still lie on my bed now and scroll on my phone, but I would do that at the time because it's just whatever helps you and whatever is best.
Yeah, indeed, indeed. And I think that even when people do have a pressure of time, if they're taking 10 minutes longer to do a task, but then they're not having to rest for half an hour afterwards to function again, then they're actually being more efficient. And you touched on stair climbing there, and I think you had a
Yeah.
question on stair climbing, did you?
Yeah. So it said, is there any tip to cope with stair climbing? It's my final big trigger. I can't seem to get on top of it. Could it be a relative weakness in my quads?
So quite often it is the fatigue inhibiting the quads rather than being a true weakness. But again, you'd need a specific assessment for that. If there's variability about stair climbing, I spoke to somebody earlier on, she said you can almost run upstairs one day and then can barely do 2 steps the next day. Well, that's not a weakness problem. It's not even a fitness problem. That shows a true physiological fatigue problem. And that's what I've heard lots of people saying to me over the last 3 or 4 years. So I think that really breaking it down, I say to people, what's your tolerance level? So sometimes people can walk upstairs slowly, but they still get exhausted. Sometimes it will be a case that they go halfway and think, I need to take a break, and then they'll continue on, but they're still exhausted. What I would be saying is that if they go halfway and they feel they need a break, then they need to be doing about 2 steps and take a break. So I think what I'm meaning by that is do both feet onto the one step, both feet onto the one step, pause. And then the next step after a 10-second pause, for instance, the other foot leading and the other foot leading and pausing. And I had one lady that we actually cut it back to doing 1 step, 10 seconds pause, another step with the other leg, 10-second pause. And she was okay on that. Physically, she got really frustrated, but she did it and didn't have to go and lie down for half an hour. Then she did 2 steps, pause, 2 steps, pause, was okay. 3 steps, pause, was okay on a good day, but not on a bad day. So she knew she either had to do 2 or 3 steps and then pause. So that meant that she wasn't avoiding the stairs, but she was limiting how often she was doing it. She was doing it in a lot more controlled manner. So she kept some good leg strength there because she was actually completing the task. She wasn't getting wiped out at the end, and she's one of the people that it really helped with that reframing of, because she was going up the stairs and lying down for half an hour and then be wiped out for the rest of the day. Whereas she would take I don't know, about 3 minutes to climb a normal set of stairs, and then we'd sit down, do a minute of breath work, and be good to go again. So it was really saying, well, how long is it until you're ready to go again, rather than how long does it take you to do the stairs. One of the emerging things with people with a POTS type presentation, even whether they've not got clinical POTS, is that sometimes when they're standing static, then their heart rate spikes because they spike when they're standing. So it's a little bit of trial and error with those people. What is best for them? Is it that they just kind of pad on the spot a little bit or tense and relax their muscles without actually climbing? Because climbing stairs is actually a strength endurance event, whereas walking on the flat is more an endurance event. It's not got a strength component. So yeah, I think that really just breaking it down as far as you can and working out what your level is. And then I've had people that will get to a point that they can actually do stairs more regularly, and they're actually retaining their muscle bulk. And for all that lots of people talk about losing their muscles and losing their strength, when I had to cut back things after I did my lactate threshold testing, which showed that I was overdoing things, we kept an eye on my muscle bulk to see how much I lost, and I didn't. Because I was keeping active but just below that threshold level. And for anybody, we know that that's a level that will help to retain muscle.
Yeah, definitely. And I think just that reframing of everything, even though at the time, it might seem ridiculous, it's really frustrating, it's not what we've done before, it will then propel you forwards. And it's just about kind of not changing, reframing it is, isn't it? And even though it's, it's so annoying, it's not what you should be doing. It's how you get out of it.
Yeah.
And so definitely for that. I mean, we live in a 3-story house, so I like stairs were everything for me, and every single time, I'd be completely breathless, and then the reframing of it by just doing a step at a time and waiting until it calmed down again and then going again, it helped me straight away, and I kind of saw such a great increase in my ability once I kind of pulled back, and that is, you can apply that to everything really, can't you?
Indeed, and I think that, as you said, it's where you are for now, because I went from running marathons and running up 5 flights of stairs and not thinking about it to literally, even though I could do a full flight of stairs here in the house, it would exhaust me. My heart rate would be spiking, so I was having to stop after 3 steps. Wife and daughter were getting driven mad by if they're stuck behind me. And talking about that and peer pressure, one of the things that a lot of people have said is, well, that's okay in the house, but particularly in London, if you're on the underground or somewhere, you can't be stopping every 3 steps. And well, you can, but it's just having that strength of mind to do it. And what one of my patients has highlighted was, even though she didn't have any leg problems or balance problems, she got a walking stick because it's a visual thing. So when she was going up 3 steps and she had her walking stick, people are asking if they could help her rather than getting frustrated with her. So it's sometimes one of those things, and we shouldn't have to. And society should be open-minded that not all disabilities and ailments are visual things. But if you do have something visual, people are a lot more responsive in the way that if you get onto a tube in London, if you've got a walking stick, you've got a slightly bigger chance that somebody may give you one of the seats. Slightly greater.
Just a little. Fab. Grace says, can you recommend any compression garments, socks, tights, leggings, anything like that?
Yeah, so for people who maybe aren't aware, one of the things that can get recommended for POTS and POTS type problems is getting compression garments to try to get the blood flow pumping back up. So basically what happens is that if you've got POTS, then one of the characteristics can be that your blood vessels open up too much. You get too much pooling of the fluid in the lower limbs, and because you're not getting enough blood coming back up, your blood pressure can drop and your heart rate can compensatory spike. And there are other mechanisms at play there. That's a very, very simplistic view of it. So the ways that you can help that is by increasing your fluid intake, increasing the salt intake, which can be quite controversial because we know that we've been getting told for years to reduce our salt, but what salt does is helps to increase the circulating volume and keep the fluid in the system. The POTS UK website has got some really, really good advice on lifestyle factors for that. And one of those things is about compression garments. Now, I've spoken to consultants who specialise in POTS, and I've asked the same question as I think it was Grace asked. Is there a particular brand that they would recommend? And do they need to be surgical compression stockings, etc.? And that consultant and others that I've spoken to since have said that they personally find that the compression garments are one of the less important things, for a couple of reasons. One is that there's no consensus about how much compression you should have. So a lot of the over-the-counter ones that feel like you're giving a bit of a squeeze can be really beneficial for that individual, preferably being right up to waist level. Theoretically, even an abdominal binder for some people if they're really bad with it. I personally use the ones that I used to use for running. If I'm having a bad time, then just my running compression leggings can really help. However, then we were laughing about it beforehand. I once put my back out trying to put these really tight leggings on. And that's one of the other considerations that the doctor had said, that if you're putting on compression stockings or compression leggings, if they're tight enough to make a difference, unless you've got help to put them on, they could well just cause a spike and knock you out for the day. So I think that there's lots of other things you can look at. The POTS UK charity website has got some good advice on the things that people can do. And if you are going to use leggings, preferably get somebody else to help to get them over your ankles. Use leggings rather than just the calf supports if you can, and work out what's right for you.
Yeah, amazing. And then the final question, how can I build back muscle that I've lost? Every time I try light strength exercises, I crash.
Yeah, so real controversial area within the long COVID and, for that matter, chronic fatigue ME community about exercise and muscle strengthening, etc. And it's a topic I could probably talk about all day, but we don't have all day. So I think that if somebody is continually crashing when they try to start an activity or exercise regime, then they need to think that that's maybe just a bit too much for them at that time. And I think when we're looking at the definitions of exercise and physical activity, without getting too geeky and sciencey here, physical activity is any activity that's using mainly the major muscles that has an energy cost to it. Exercise is a subsection of that is done for a particular reason, usually health or sporting performance. That does not necessarily mean that exercise is harder, that has got greater energy requirements. So for instance, going out for a walk can use a certain amount of energy. Walking upstairs at the same pace uses at least twice as much energy. And yet you're not doing exercise, you're going upstairs to go to bed or to go to the loo, etc. So I think that's a little bit debunking the myth that exercise is tougher than physical activity. Because quite often patients will have a higher heart rate spike in the shower than they will do when they are walking. And I know there's lots of other things at play if they've got POTS, but it's just as an example. So I think what we've got to think about is your total exertion levels and where you're using your limited energy. And I've had people that will decide that, right, on the day that I'm going to do a bit of exercise for mental health reasons or whatever, I will not do other activities. So when we're thinking about the wider picture of the physical, the cognitive, the emotional, the social interaction, the sensory input, all the things that drain our energy battery, you've got to think of where is our energy getting drained. And if one of my priorities out of plan, pace, prioritize is that I want to do a bit of exercise, then how can I get that frequency, intensity, type of exercise correct, and the time that you're doing it for, both in an individual slot and as a collective over the course of a day or over the course of a week. So it can get quite precise and quite individual. And we've usually got to find that you've got to increase your safe aerobic activity. So that might be going for a walk well within your limits and starting off at a low level. And remembering one of your biggest strengthening activities is actually taking your body weight through one leg and then through another leg. And so walking isn't seen as a strength activity, but when you're struggling to function, then it is. It's a repeated strength endurance activity. So you've got to bear that into mind, but it can get really, really complex. And what we have seen, myself included, as some of you know, I've got back to running. If I keep my heart rate under control, then I can run for a long period of time, but that's taken 3 years to build to. If I go into the gym just now, my 16-year-old daughter will be outdoing me because I can't keep up, because I know that if I do 3 sets of each weighted exercise, after about 2 sets of the first exercise, I'll be wiped out. So when I have tried to build back any strength, it has been literally do a way sub-maximal set of exercise. So if I could do 10 repetitions, I'd be doing 5. I would literally be having an hour's break between each of them. So between calls, I'd go and do them. So there's a lot of breaking it down. And that's where a lot of my patients that have come to see me privately, they're really wanting that guidance on how do I stabilise then if I can't just exercise my way out of this, and then how do I progress safely when I am heading in the right direction. But you need that period of stability first.
Yeah.
So that's a long answer to a short question.
I think it kind of goes back to the almost like the reframing, because what do you think like exercise is? Do you know what I mean? It's kind of, I feel like we all assume like exercise is, just kind of a very simple, almost like Pilates or anything, but that's so hard to do, and if you haven't been doing it for such a long period of time, you're not going to be able to. But also, just in a side of like the long COVID side of things, it's so hard to do all that. I can go to the gym now, and I do go regularly now, but it's taken me 2.5 years, and I literally started doing Pilates, and I was doing it before, so I kind of was already able to do it. But I was doing it once a week and then leaving a week, and then it's so slow building it up.
Yeah, and I think that's a really important point that you made about really spacing it out, because what I had with as people were stabilising and they're ready to progress, I had people that came to me, they said, right, I've done the stabilising bit, but I tried to progress things and I was going well, and then it crashed for no apparent reason. But we've noticed a pattern of people, rather than getting crashing fatigue, they've got creeping fatigue, that things just gradually build up on them, and then they'll straw that breaks the camel's back, something will knock them over the edge. And it's really interesting what you're saying about doing certain activities. So I got told to do some Tai Chi. Now, Tai Chi can go from very basic grannies in their armchair doing it to actually being a martial art. So somebody put me onto Qi Gong, which is a form of Tai Chi, and very gentle movements. And I used it, felt benefit from it. I had a triathlete who just wanted to get back into exercise, and he was fed up of people telling him what not to do. So I said to him to get working his breathing exercises that I've talked about already, and to work on this qigong, and he kind of turned his nose up at it. And then he noticed a really interesting thing. For one, it meant that he could complete it, but he felt he'd done something. He actually felt he'd had a bit of a workout. Whereas I told him to watch the video before he's doing it, and he thought, it's going to be easy for me. But it actually got him to that sweet spot, and he felt it wasn't too easy, wasn't too hard, didn't get a reaction in an adverse way to it, so that was good. He felt that he could actually do something. He'd been so used to that sense of failure. But really interestingly, he had felt he'd lost so much muscle bulk. And then a couple of days later, he noticed that he looked like he'd had a bit more muscle bulk. Now, you couldn't have put that muscle on in the time, but one of the interesting things about muscle is that when you're using muscles, they will grab onto carbohydrate in the form of glycogen. And for every 1 gram of carbohydrate your muscles hold, it can hold 3 grams of water. So that will bulk your muscle up and make it look and feel bigger. If you're not exercising those muscles and they're not grabbing that carbohydrate, they won't grab that water. So then your muscles will look like an athlete who's carb depleting before a marathon, etc. That they will lose lots of weight and then suddenly gain it when they eat any carbs because their muscles get really receptive to it.
Yeah.
So that really showed that he hadn't lost quite as much muscle bulk as he thought he had done. Because when he exercised at the right level, had a protein and carbohydrate shake afterwards, his body grabbed onto that.
Amazing.
And it's just amazing. So yeah, so my background as well being a marathon runner, I was a marathon coach. So there's lots of things that I bring from my coaching into my physio and vice versa.
Yeah. Brilliant. Well, thank you so much. That's been so amazing. And I really hope people have got a lot from that. I mean, we could have gone on for so long. But no, that's just been so amazing. All the tips, so some of the things that you mentioned, the kind of like the FIT principles, the PPP, that's all available on the Instagram, but also it's going to be going out as an ebook very soon. So that should be available hopefully by kind of end of this week. It obviously depends how fast I edit this.
That's excellent, and
But
thank you for all you've done with that, Bella.
no, it's been amazing. So yeah, thank you so much for taking time to do this. I really, really appreciate it, and I'm sure everybody who has asked the questions and everyone listening has as well. It's been really, really incredible. Thank you.
Thank you very much, Bella.